Hey, in this video, I'm going to show you how to more easily get up out of chairs if you've got knee pain. This could apply to you for a variety of reasons of knee pain. It could be that you just had a recent surgery like a knee replacement, an ACL repair, a meniscus surgery. You may have also just sprained your knee, or you may be dealing with some chronic knee problems like a meniscus tear, knee arthritis, tons of other reasons for knee pain, a Baker's cyst. You may have a ligament injury. If your knee is irritated right now and painful and it just hurts to bend it all the way or to bend it at all and put pressure through it when you stand up, getting out of chairs is tough, especially lower chairs, places like toilet seats or cars that are really low. Those can be especially difficult. So I'm going to walk you through ways to make this much easier for yourself. So the first thing is to make sure you scoot to the edge of the chair always. So if you're, say, at home in a recliner in your favorite chair and you're sitting like this, most people don't think, let me scoot to the edge, to the front of the seat, and then get up. That gives you more space to get your feet under you, to put your arms in a position where you can use them to get off the chair, to put them on your knees. But if your legs are out here and then you're trying to get up like that, it's just not as easy versus if you can get your feet under you a little bit better, which means you need to scoot to the edge of the seat. So when you get your feet under you, it's just much easier to get up this way rather than having to throw your weight over your feet because your feet are out in front of you like that. Another thing is leaning forward enough. So once you get your feet under you properly, making sure you lean your body forward enough to get your weight over your feet is a big deal. Some people try to stand up from back here and they're leaning backwards and their weight's not over their feet. That might be the way you think to do it. If it hurts to bend your knee because you're leaning forward like this, you can kick out a leg and lean on your good side, on the side that doesn't bother you, and try to put more pressure to that. But you see how my weight's over my foot here? My foot's under my body, not out ahead of me, and I can use that leg a lot easier. Now, I've already talked about using your hands. Using your hands is really important because it'll take some pressure off your leg. The best places to put your hands are going to be on the armrest. If you've got armrests on your chair, or even if you're on a couch, you're not near an armrest, just pushing off the seat right here can be quite helpful. If you've got a walker or a cane nearby, put it in front of you. Grab that cane right here, put it between your legs in front of you and push off the cane right here. Or the walker, as long as the walker's sturdy, you might pull on it like a rolling walker, one of those big walkers that has wheels on it. The small ones that don't have wheels might tip over, so don't rely on that one. You can always test it out a bit to see if it's going to hold you up, and if you can get your body weight over it enough to help you with standing up. And then of course you've always got this spot right here, just putting your hands on your knees as a way to offload some of your muscles. That helps you to stand up as well. And if one knee is bothering you, you can't quite put pressure on it that way, put two hands on one knee, the good knee, the one that doesn't bother you. You might kick out this leg and still push up like that. Now let's talk about the way you're using your muscles. Ideally, right before you go to stand up, you should be thinking about tightening your butt muscles. The butt muscles back here should be the main muscle driving you up. What most people do is use their quad muscles in the front here. And if you've got a knee problem, when you use your quad muscles, it's going to aggravate your knee problem. That's the main reason why people get more knee pain when standing, and they look to avoid trying to stand up because it just hurts their knee. But if you can switch over to using your glute muscles, that's really the right way to be standing, and it offloads your knee. You're not using the muscles that compress your knee joint more. So the way this looks, because you might be able to stand up just like I am right now if your knee isn't too terribly bad. Of course, scoot to the edge, get your feet under you, open your knees up like this. If you're a lady, be modest, or make sure you're covered up, or ideally you're alone, it doesn't matter. And get your feet angled out, turned out just a little bit like this. So toes out, get your knees out wide, scoot your bottom to the edge, feet kind of under your body, and then slowly shift your weight over your body. Then already you should be thinking about squeezing your butt muscles and use those butt muscles to stand up. So when you're coming, if you're sitting down like this, you should be already tightening and then tightening them as you come up. That should decrease the knee pain a notch or two, or maybe even completely if you can do it effectively. Now this does require that you have some glute strength. If you don't feel like you have any glute strength, then this may not work very well for you, and you may need to go be working on your glute strength so that you can get your knee pain better when standing up from a chair. If you don't have glute strength, it's going to cause you many, many problems going forward. So you got to go back and get that. That's often the root problem of many knee problems. Now, what if you can't bend your knee right? You don't have good mobility in the knee. It could be that you're suffering from arthritis, or you just had a surgery of some sort and your mobility just isn't great. You need to be able to kick out that leg. It's incredibly important that you just offload that leg, because you're not going to work on that leg in that moment. You don't have to worry about putting pressure through it. If your knee is stuck and you can't bend it, and it's just the way it's going to be right now, you need to be working on your knee mobility some other time, likely. Going to go stand up, like if you have to go to the bathroom and you kind of have to hurry over there, that's not the time to be working on your knee. Once you have 90% plus of the motion you're supposed to get in your knee, then I'd be okay with you putting some pressure on it to make sure that you're working that knee, that you're using it. But if right now, say you're just a few weeks out of having a knee replacement or some knee surgery, your knee's just not going to bend. Be relying on doing this kind of motion right here when you get up off the toilet, when you get in and out of a car, when you just go stand up from any chair. And another tip that can help you out tremendously if you've got a knee that doesn't bend very well is raise the seat if you are able to. Now, I've got this computer chair here on purpose because a computer chair might be the best place for you to be sitting if you have a knee replacement. You might put this in front of the television or wherever you like to be. And this one's got nice adjustable armrests. So whatever computer chair works for you, as long as you can elevate it up. At home, what you can do if you are sitting in a couch or your favorite chair and it doesn't have the ability to go up and down like this, is sit on pillows. Go get pillows from your bed. If you have throw pillows on your couch, get blankets. Put something soft under your bottom to elevate you up from the normal level of the couch or the seat, so that when you go to stand up, now your knees aren't bent as much. You're starting from a higher place. So it'll be a lot easier for you to get up rather than it being way low here and you having a harder time. Now, I always get the question, what about cars and what about toilet seats? Because cars, vehicles might be really low. Those are tough to deal with. The nice thing about cars is usually there's places for you to hang on to and hold on to. Your car might have a handle on the frame of the car. Your best bet is if let's say you're in either the passenger seat or the driver's seat of the car, you need to turn before you get up out of the car. So let's say that this is the front of the car. You need to turn your body after you open the door, of course, and get your legs right here, and then grab the frame of the car to pull yourself up out of the car. If you're in the passenger seat, you might be this way, depending on what country you're in. And what you don't want to do is get out like you normally would, where you stick one leg out and then you're trying to stand on one leg as you're standing up out of the car. You need to turn both feet out of the car, so scoot over and then get ready to hold the edges of the car, scoot your bottom to the edge. Think about opening up your legs, firing your glute muscles as you stand up. You might just have to modify to this whenever you're getting in and out of the cars for a short time. Now, toilet seats, they might be a little bit tricky because depending on your bathroom setup, ideally you have a sink nearby or some structure nearby that you can grab onto and hold onto to help push yourself up off the toilet seat. Sometimes toilet seats are very low as well, but there are devices out there that are well worth it, especially if you just had a surgery or if you've got more permanent knee problems like knee arthritis and you're just having trouble just with the toilet. There's things called toilet risers. These are devices that go over your toilet seat and they'll add an extra few inches, sometimes 6 inches or more of height to your toilet seat, so you can still sit on the commode and do your business, but you're sitting higher and it's much easier to get up off the toilet. There's also a version that has handles on the side, so you can press off the handles, and they're very much like these armrests right here. I've linked in the description below toilet seat risers that might benefit you in case you need that at home. I hope this video was helpful for you. If you thought it was, give us a thumbs up, drop a comment below if you have any questions. We try to get back to those as fast as possible, and I'll catch you in the next video. Bye-bye.